Each legislative session, KHI is hard at work, keeping you informed on the latest health policy discussions from across the street in downtown Topeka. Health at the Capitol is a KHI production, a monthly recap with our legislative monitoring team, offering you a closer look at policy work happening now in Kansas and coming up. Thanks for joining us for another edition of Health at the Capitol. I'm Teresa Freed, your host. I have with me Linda and Val, who lead our legislative monitoring team. Today we're going to talk about all things turnaround day and see what made it through and also what got held up. And then we'll also talk about some of our federal health policies that we're watching as well. So lots to discuss. Linda, so first off, we're going to talk about what exactly Turnaround Day is. It was February 19th, and what exactly does that mark?
Yeah, so last Thursday, February 19th, was what was referred to as Turnaround Day. And basically what that means is that any bills that are going to continue to progress through the rest of the session have to have gotten through one chamber, so gotten through their committee where they probably started off, and then at least gotten passed by that particular chamber. And so those bills go both ways, House and Senate, and they kind of switch. And then after turnaround, they start working each other's bills and switching around. So that's the one way that bills can stay active. The other way that bills can stay active is if they are in certain types of committees. So the federal and state committees, both on the House and Senate side, also the budget committees on both sides, and then tax and a few other kind of unusual committees. And so sometimes the legislators, if they're not going to be able to get a bill all the way passed, they will transfer it into one of those committees, and it sort of gets saved or blessed is the term that we use. So anyway, those bills are still there, and when they come back, so they're off today. Well, we're recording this on February 23rd. And they will be returning tomorrow. So they had a day off on Friday and today, long weekend, and they'll be back tomorrow and start working each other's bills.
All right. And Val, we were talking about this a little bit ago. You guys did a very good job of making some predictions about what was going to make it through. So can you highlight some of those?
Yeah. So one of the things that we knew that they were going to talk about was the cell phones in schools, talking about the mental health aspect, and they did pass a bill that would require public and accredited non-public schools to implement a bell-to-bell policy. There was some discussion on whether or not to include some of those private schools, and ultimately they did include some of those. And then they'll also kind of be taking a look at fiscally what that means for districts, because they'll have to figure out a way to make sure that those cell phones stay out of the classrooms. So that has passed the House, and it will now go to the Senate.
From a parent perspective, it seems like almost a no-brainer. You think you want your kids to be focused on school. What were some of the exemptions or exceptions that people were concerned about where students might need access to a cell phone?
Yeah, I think like in emergencies, which in the bill they did have some provisions for being able to use a school phone for contacting parents. I think there are also some provisions related to those on 504 plans and some other considerations there.
Okay. We're going to talk about a little bit about the budget process and where we're at with that. So
I think we talked about this a little bit during the preview, but this is the second year now that the legislature has taken a different approach to how they are moving on their budget bills. And so as we mentioned earlier in the past, that was more led by the governor. Her budget would come out and then they would start working from there. But the last couple of years, they've actually started working on their budgets even before the session started. So certainly that happened this year. And both the House and the Senate had bills that they started working almost at the beginning of the session related to budget. So the House made a lot of progress on theirs, and that has passed, and we'll move over to the Senate side, and there will continue to be that work on it. But it is very different process and moves very fast. So that is a real challenge for any of the parties who are trying to get funding for various things into the budget, because that moves so quickly. They had to really either get those things in before the session started, or needed to be able to come and testify when they were having those hearings early on.
Was there a point or a particular topic within any of the budgets that really they got stuck on and they were finding some challenges?
They really didn't, because of the fact that they have done so much of this work before the session starts. Some of that has kind of already worked through. So they had already gotten presentations from a number of the state agencies in terms of what they were going to need for funding. So, I mean, there's always discussion about, do we cover this? Do we cover that? But I think that, that process has gone along pretty smoothly, and they have, again, the House Appropriations Committee was able to move forward with their bill.
All right. So another hot topic, of course, has been workforce related to health. So can you talk about some of the key legislation there?
Yeah, so workforce is always a topic of interest, both scope of work and licensing, and trying to improve some workforce shortages. We did see some compacts again, athletic trainers and estheticians. And then we saw some scope of work changes, physical therapists to perform some capillary tests, some pharmacist scope of practice changes, licensing speech language pathologist assistants, adding APRNs to the Healthcare Stabilization Fund, and a lot of just various ways to potentially address some of those workforce shortages, changes to some loan programs and things like that.
All right. And just from a communications, public relations perspective, I know the State Board of Nursing came up quite a bit in the news, in the headlines. And so what was the challenge there?
So they did end up making some changes to the powers for the State Board of Nursing. There were some concerns with some disciplinary actions related to licensure renewal. And so they did void, they passed a bill that would void some of those actions that took place, I think, from 2005 to 2026.
Got it.
And Teresa, I might mention on that Board of Nursing legislation that's going through, one of the things that did come up at the end when the bill did finally pass through was some of the legislators were commenting that this was maybe really just the first step in sort of updating that Nurses Licensing Act. One of the legislators that said, they weren't totally happy with what was being done right now, but sort of recognized it as kind of a first step into starting to bring that act up to current. So we'll expect to see it more in the coming sessions.
All right, we'll continue to follow that as well. All right, so the next topic, and this is one that is always brought up in one form or another, is child welfare. There are always improvements that can be made in the system, of course. And so what were some of the key actions? Well,
so I actually, Val probably is better equipped to speak as specifics about this, but I think the thing that was most interesting to me, and I think during the preview, we did bring up the fact that we thought we were going to continue to see a lot more of child welfare legislation. That's something that they've really been focused on the last few years. And then I think we had gotten some indications even before the session started that this was absolutely going to be a year for child welfare. And I think that what's so interesting is the broad number of topics that they are covering related to children. So, Val mentioned the cell phones and the focus on improving academic performance and some mental health improvements and those kinds of things. But they are, they're focusing, as you can imagine, continue to focus on the foster care system and children entering the system and exiting the system and trying to get that process to move quicker. Excuse me. And also, I mean, all the way to things that are very technical. So focusing on how children can access social media and the time that they spend on the internet and on apps, and so that there's this very, very broad focus on protecting children. I think we may have mentioned this before. I can't recall, but there's a bill that wants to really encourage school districts to expand the amount of time that they allow children for recess. So it's just, there are so many different things where they have touched, trying to protect children, trying to take care of children, trying to, make sure that there are protections, but as you can imagine, things like making sure there's training for to identify sexual abuse and those kinds of things. So it's really a big job to keep up with just with the things that I think we here at KHI certainly refer to as child welfare, because they are covering a wide variety of topics.
Right. All right, Val, any of those in particular you want to highlight?
Two bills that passed the House so far relate to establishing a child abuse and neglect registry, and then also making child abuse reporting not anonymous anymore. And so they'll be looking at that, really trying to make sure that people are identifying themselves when reporting to DCF. Law enforcement reporting would still be anonymous, but they did put some confidentiality protections in there, trying to encourage people to still identify themselves when reporting.
Okay. All right. And the next topic sort of somewhat related to the previous one, but when we talk about drug abuse and substance use, so several different pieces of legislation that have been considered. Can you talk about those?
Yeah, and this is something that recently at the federal level, they've also highlighted some additional funding for substance use and opioid topics. But one of the bills that passed the House would allow people to use expired naloxone or an emergency opioid antagonist, I guess is the official term for it. And also essentially create like a good Samaritan for those who do use an antagonist like that, for really encouraging the public to seek help or help someone when needed.
So that would be someone would be able to intervene to help with that process without being penalized or punished. Okay.
And then again, talking about children, putting fentanyl education programs into schools. That bill has also passed one of the chambers. And so schools will also be stocking naloxone as part of that as well.
Okay. And there has been a lot of discussion about fentanyl all across the country, of course. So is this just one step, or do you see that there might be additional steps to sort of help regulate or protect adults and children in that?
Likely just the first step. Yeah.
Teresa, I might mention one other topic that came up this year, and this actually came up several years ago, and at a time when I certainly didn't know what this was, but this leaf called kratom, which is something that apparently has been broadly used and is sold and available to people who want to purchase that product. And it has in some ways reminds me a little bit of some of the things that they talk about marijuana and THC in terms of being able to relieve pain and that kind of thing. So there were people that were using this. There is a bill that got a lot of attention this session about kratom and whether or not it needed to be moved up to the more serious Schedule 1 for the kinds of effects that it could have on people. And of course, as you can imagine, the people that have been using it and selling it for some time are saying, oh, it's not as bad as that, and that there's some confusion about one of the chemicals that can actually be generated from kratom. So it's one of those topics that, a few years ago, it was a word I'd never heard, but now it's all over the place.
So is this the one that they refer to, I think, as a convenience store or gas station drug? Is that right?
Well, I think it is that readily available. I mean, there's actually a Kansas Kratom Association. So there is enough of a market for this product that there's plenty of folks out there selling it. And most of the people who are selling it are people who started using it themselves and got some relief, and so decided to start marketing the product as well.
So probably more discussion on that one as well,
absolutely.
Right? Okay, so kind of moving to this hybrid discussion of both state and federal policy. We know that we've been watching the federal health policy all year long, of course, and there are many things that are decided at the federal level that do have state implications. And so, or just the state reacting to some of the news that's happening at the federal level, including supplemental nutrition assistance benefits as well as food additives. And so do you want to talk a little bit about the state action related to those?
Yeah, so the Make America Healthy, or MAHA again, or Make America Healthy Again, or MAHA movement has had a pretty big focus on food additives. And so they did pass a bill out of the Senate that would, for schools that participate in like free or reduced lunch or free breakfast programs, they would be required to remove specific additives from their food starting in the 2027 school year.
All right. And if you want to touch a little bit more on the SNAP waiver.
Yeah, so this was a bill that was passed last year requiring DCF to apply for a SNAP waiver that would exclude candy and soft drinks. And so that waiver has been submitted, but there's been some discussion on how long it's been taking and the responses that they're getting from the federal government, and that it hasn't been approved yet. And so they actually passed a bill out of the House that put some parameters around that waiver, and then also added a new definition of candy. And so there's been some discussion on whether that would kind of delay the waiver further. But that bill did pass the House, and we'll kind of see when that waiver gets approved. And there's some guidelines that the bill has once the waiver is approved to keep it updated and get it implemented.
Okay.
Yeah, and it's interesting because as Val mentioned, last year there was a bill that was going through that was trying to get DCF to direct DCF to submit that waiver application. And it didn't make it all the way through. So at the end of the session, they put a proviso into the budget bill, which basically withheld some funding from DCF until that waiver application was submitted and then was subsequently released. And so, as Val indicated, now there is a bill that at least has made it halfway through that would that again puts some additional very specific parameters in terms of when the application is to be submitted, also acknowledging the fact that there is already an application that's pending, and then also making sure that if that gets denied, that it gets redone, but also wants to focus on this different definition of candy. And I think that there is the DCF representatives have said, we may actually be interfering with the process now if we go back and try to change some of our language. But they went back and legislature went back and pulled some definition from an Oklahoma waiver that had been approved and went with that definition this time. So we'll see. But I did notice that there have been a couple of amendments to be added to budget bills that potentially would do something similar to last year, which would be to also withhold some administrative funding for DCF until that waiver application actually gets approved. So they're kind of doing it in a couple of different ways.
And it seems like with Make America Healthy Again, I don't want to say pressure, but there is a certain degree of pressure from the federal government to sort of align state initiatives with what they're doing. And so do you see that as something that's kind of holding up programs or services in the state, or is that something that they're kind of falling in line and making those accommodations?
I absolutely think that there's some compliance that's trying to occur, or some syncing up with what they see coming from the federal government. And and there are a number of organizations around the country that have historically taken a very conservative approach to some of these public assistance programs. And so we certainly are seeing some of the language coming from those organizations in terms of what's in bills.
And another area we're seeing some direction or some leadership is in the area of pharmaceuticals and making certain medications more accessible, more affordable from the federal government's perspective. So how do we see that kind of trickling down to Kansas?
We weren't sure if we were going to see anything regarding PBMs. They ultimately did pass a bill through the Senate to regulate some PBMs.
And that stands for?
Pharmacy benefit managers.
Oh, sorry. Thank you.
To regulate pharmacy benefit managers, requiring registration and some auditing and reporting requirements. We're also seeing movement at the federal level for that. President Trump signed part of the Consolidated Appropriations Act at the beginning of February that did some of the similar things. Those reforms would begin in 2028, 2029 time period. But again, some of the standardized reporting, transparency, some rebate pass-through, making sure the rebates are going to the people that they say they're going to, and some of the reforms like that.
Okay.
Yeah. So on the PBMs, Teresa, that is again, this is an issue that has been sort of percolating for a few years. There are a lot of these questions about pharmacy benefit managers and what do they do, and how do they decide how much to reimburse pharmacies for drugs, and are there certain drug lists that they're using, and those kinds of things. And so I think, Kansas obviously is doing our bill this year, but for the past few years, there have been a number of states that have tried to pass PBM legislation because it was not happening at the federal level. And I think the states were getting a little antsy about that and decided they wanted to do something else. So as she mentioned, there is some language in that budget bill that came out. And it'll be interesting to see how those all sync up, because I suppose it's possible that if the federal government continues to move in this direction, it may preempt some of the things that have been done at the state level. But I think, as she said, the federal provisions don't go into place for a while. So I think the states are still trying to get some other provisions put in place before then.
And that seems sort of unusual with this administration that you have that much time. I'm sure it's necessary, but it almost feels like who can move faster, the state or federal. At this point, there's so much activity happening. So as we kind of wrap up this episode, any last minute items we want to talk about? I know there's some discussion about rural health and what's happening there.
Yeah. So again, as the audience probably knows, we have the Rural Health Transformation program grant that Kansas, like all the other states, was awarded, and that happened. A lot of that activity in terms of getting ready to submit that application to the federal government for approval happened while the legislature was not in session, and so they really didn't have a lot of opportunity to sort of weigh in on how that application was put together and what kinds of things were put in there. So, certainly during the session up to this point, there's been a lot of interest in having KDHE come and talk to the various committees to explain to them how that process came about, what was done, what does that plan look like. And I think at this point, the legislature is, understands that it's kind of a done deal in terms of what's been approved for that, for this 5-year program going forward. But they are very interested in understanding how this is all going to play out, and to the extent that they have an opportunity to, contribute ideas or thoughts into how that grant is ultimately used. I think they're trying to do that. But there's certainly a lot of interest in it right at the beginning of the session, that because they were very curious about that grant and how it came together and how it was going to be implemented.
All right. And since it's a 5-year process, it's going to probably be a topic of conversation for a bit to come.
Right.
And even though the check's written, it hasn't been implemented, right?
Right.
So they can still potentially have some opinions about that.
I think they can. I know the testimony that's come from KDHE has been sort of what they put in the plan is kind of what's approved, and that there perhaps is not as much flexibility in there as maybe the legislature would like there to be. But again, I think to the extent that they're able to at least have an opportunity to listen in and see what's going to happen and where it's going to happen. Obviously, if you're a legislator, you'd like to know if there are benefits that are going to come to your district. And so they're certainly interested in where these things are happening.
That makes perfect sense. Okay, so for the rest of the session, key dates, March 27th is first adjournment, and veto session is April 9th. So more or less, we have a month left to get all this work done.
Yes.
So we'll be following that, of course, but then also we are monitoring and sharing out that information. So you want to talk about the next publication?
Right. So for this week, because of turnaround, in addition to our normal Health at the Capitol summary that we did for last week, we'll also be putting together a full list of all the health-related bills that did make it through turnaround, and so is still active for the second half of the session. And so that list will be coming out as well.
All right. Our small but mighty team is working hard again. So We appreciate you tuning into this edition of Health at the Capitol. Join us next time.
Thanks for joining us for Health at the Capitol. Sign up to receive our emails at kchi.org to get a weekly recap of health policy activity during the Kansas Legislative session. You'll also receive our latest publications and information about upcoming events.